Hi, my name is Virginia. This is my fourth upcoming IUI, my second one with injectables. I'm not going to talk that much during this video because I've tried and it ends up being really long. So I'm just going to let you observe my routine and make a few comments on tips below this video. Okay, here we go. I've already cleaned this counter off with alcohol, by the way. That's what I was just doing before I pressed record. So just checking to make sure it's recording. And my water takes a long time to get hot. The one thing I will say is if you can, I'll put the link below this video. You should really get what they call an injection kit, which comes with all of the right size needles, syringes, adapters, everything you need for injecting stress-free, because I've tried to do it my first injectable round without it and it was way more stressful, okay? So I'm using Brevell. It comes in the vials like the other injectables. And I will be mixing 2 vials today, so you'll be able to see that as well. So I'm just taking out what I'm going to need ahead of time so that everything's there. I have my syringe, my needle, my adapter, my alcohol pad. And that's all that I need. Get that out of the way. My 2 vials of Brevell and my 1 vial of mixing agent, which is just sodium chloride, a Band-Aid. Okay, so I like to take everything out of the wrappers and put it on the counter that I've sterilized, just so that I have everything ready ahead of time. I'm taking the caps off of the medication. This is the needle. It's a 27.5 gauge needle. Just opening and taking out my alcohol pad. Okay, so everything's unwrapped now. I'm cleaning off and sterilizing the tops of the vials. Saving the pad for when I inject. Okay, I'm going to stop talking now because I need to concentrate. This is just the mixing agent. So I'm pulling back to 1 milliliter of air. I'm putting my Q-cap adapter on, my syringe. Pushing it down, turning it upside down, pushing the air into the vial, and then the correct amount will come back out. I'm just going to push it back up in there because there's a lot of air and do it over. It'll move all the way down on its own. With the adapter, all you do is push to the side. Comes right off. Now I'm doing the same thing with the Brevell. Pushing it down. I'm going to push the fluid in. Now, going like that, it just kind of helps mix the powder up into a clear solution. And I just kind of look to make sure, okay, it's pretty much dissolved in there already. Now I turn it upside down. suck it all back into the syringe. So this is my mixed up vial of Breville. I'm pulling it down until there's no medicine left in the vial. And I usually just kind of tap because I get a little bit obsessed that I'm getting all of it out, even though they say they give you a little extra, so that if there's some left in the vial, it's not a big deal. Okay, then I'm pulling it off to the side. I check I got all of it. Now I need to mix in 2 doses. So now I'm putting the mixed Breville that I just did and injecting it down into the second vial of powder. So now I'll have a twice as strong mixture. Your doctor will tell you how many vials of Breville to mix at a time, depending on your blood test and ultrasound results, okay? Checking, it's all dissolved. Upside down, down into the syringe. Again, you can see it's going down on its own. This is coming down. Just give it a helping hand. I'm tapping, just want to make sure all that fluid is coming down, even though I don't know if that actually does anything. Off to the side. Got it all out. Now I'm just pulling down more air. Make sure there's nothing up in the top. Now you unscrew the adapter, take it off, and this is when you screw on your injection syringe. So it's on there now. Take the cap off. I'm gonna tap out the air bubble that I can see right down at the bottom until it comes up to the top. Now the first time I did this, I thought you had to have every single little bubble out, and that's not true. They're called champagne bubbles, and you're not injecting right into the bloodstream, so you don't need to worry about those tiny, tiny ones on the bottom. So the bubble floated up to the top, but this is the hardest part that I didn't know the first time. When you're tapping, it's going up into there. So if I was to just push out the rest of the air now until one drop appeared on the end, I would lose a lot of injection medication coming out the tip while I'm pushing the air out, because there's already some up here. So this is the step that I had to learn that made all the difference. Is I'm going to pull back the syringe a little bit more now, and it's going to suck whatever's down at the top back down into the bottom. So a few drops came down. And then I'm also just going to tap a little bit, and you can see the drops coming down to the rest of it here. Well, you probably can't, but I can. Okay, so now I can push up and get rid of that air. And nothing should come out the end until the one drop is ready. And there you go. Now I can see that I still have pretty much exactly 1 milliliter of fluid in there, so I didn't lose anything. I don't think that this autofocuses very well. See if you can see. Okay, so now I'm taking my alcohol pad. I injected on this side yesterday, so I'm going to inject on this side today. This is the fun part, everybody. You're supposed to do it kind of down below to the side of your belly button. So now that's good. I'm grasping the fat that's right there. I'm just making sure you can see this. Now I'm going to go I put it in right straight. And I always count myself down. So I go 1, 2, 3 and stick it in to pump myself up. 1, 2, 3, in. Okay. It kind of hurt a little bit. That's okay. It's stinging. Now I'm pushing in the medication really slowly because I find that it does burn when it goes in. And the slower you do it, it doesn't burn as much. So it's gonna, you don't even have half of it pushed in yet. I'm just really pushing gently on the end. I'm down to half now, and I'm just pushing the rest in slowly, gradually. Okay, so it's all in. I'm just pushing a little bit harder on the end to make sure. Now, you want to let go of your skin now. And then pull straight out or else you'll get a bruise, okay? 1, 2, 3. Try to really pull straight out because if it's on an angle, I find it hurts more and you do get a bruise. So you can see the little red area where I injected. Although the camera's set to focus on my face, so I'm not sure what you can exactly see. So that's good, it's not even bleeding. So I'm just gonna put my shirt down, put the cap on over the needle. Then you can throw your entire needle or just take the actual sharp part off like this. And I have a huge friggin' sharps container they gave me at the drugstore, so in it goes. And that's how you inject your fertility medication, everybody. So I hope this might have helped you a little bit and shown you that it's not really that scary at all, okay? Thanks for watching, and good luck with everything, and baby best to everybody.